real life. A very good afternoon, sorry, a very good evening to everyone. And today's session is by Dr. Ananya, and she'll be talking about this second trimester, what to expect, do's and don'ts, and it is going to be a very interactive session. So stay tuned till the end to know more. Doctor, you have the stage.
Hi, good evening, everybody. I'm Dr. Ananya Rangaswamy. I'm a consultant obstetrician and gynecologist at Apollo Cradle Hospitals, Rajajinagar. So, today's session is mainly concerning the second trimester of pregnancy. So, what is this second trimester of pregnancy? To begin with the basics, I would like to tell you that pregnancy is divided over a period of 280 days. 280 days is about 40 weeks of pregnancy. So this 40 weeks of pregnancy, we divide it into three trimesters. So the first trimester, second trimester, and third trimester. First trimester is usually the period of where the pregnancy is established. So the period of conception. So that is from the period of conception till about 12 weeks of pregnancy. Then coming to the second trimester, it is from 13 weeks to about 26 weeks of pregnancy. And the last trimester will be from 26 completed weeks till delivery, that is about 40 weeks. So today we will be concentrating on the second trimester of pregnancy. What are the common signs and symptoms that you notice in second trimester of pregnancy? What are the common medications that is advised during pregnancy in the second trimester? What are the tests that you need to undergo? How often do you need to visit the doctor? So these there could be various doubts in your mind and various queries for the first time mothers. So I would like to have this session so that all these doubts are cleared about the second trimester of pregnancy. Okay, so like I told you, the second trimester of pregnancy is from 13 weeks to 26 weeks of pregnancy. So what are the signs and symptoms that you usually notice during this second trimester of pregnancy? Okay, I am seeing over here that somebody is asking, why should pregnancy be
Yeah,
divided?
so we have a question that why should pregnancy be divided into three trimesters?
Yes. So three trimesters, there is nothing that is specifically about each trimester of pregnancy is particular and important in its own way. So the first trimester, like I told you, it's the period of conception where the pregnancy establishes. So there are its own complications, its own effects that is there on the mother. So the first trimester signs and symptoms will be totally different, and the kind of tests that we advise will be totally different in the first 3 months of pregnancy. So for the ease of advising the patient, for the ease of telling the patient what tests she needs to undergo, she needs to take care in each part of pregnancy, we have divided the pregnancy into three months, easily into 9 months. So the 9 months is 3, 6, and 9 months we have divided. So each becomes a trimester. The first part will be the place where the conception or the pregnancy is establishing. The second part will be the organogenesis phase where the organs are developing and the pregnancy is starting to grow. And the third phase will be where the mother is getting ready and the body is getting prepared to deliver and for childbirth. So that will be in the third trimester of pregnancy. So in each trimester, the care we give, the advice we give to the mother will be different. So accordingly, we will be dividing the pregnancy into three trimesters. Okay. So coming about our session today would be the second trimester of pregnancy. So in second trimester of pregnancy, what will be to start off with the signs and symptoms of the second trimester. So first trimester, the patient would have experienced a lot of, some patients might have experienced a lot of hyperemesis or vomiting, a loss of appetite, or decreased ability to do their day-to-day activities, lot of weakness and tiredness. So those symptoms per se will start to reduce in your second trimester of pregnancy. You'll start feeling better. You'll be able to eat better. Probably the signs and symptoms of vomiting will start to reduce. You'll be able to tolerate food more easily. Okay. So as you start to eat and feel better, the abdomen starts to increase in size, or the belly starts to increase in size, because the uterus, that was a pelvic organ that was inside the pelvis, starts to grow and becomes an abdominal organ. So the abdomen starts to become more prominent. You'll start noticing your belly fat or belly becoming much bigger. So that is one thing that happens in the first thing that happens in the second trimester. So as this starts to happen, you might start feeling the quickening or the baby movements that is noticed in the second trimester of pregnancy. Usually, for a first time mother, you can notice this quickening or the movements anytime between 18 to 20 weeks of pregnancy. Sometimes, who is a second time mother who already knows what fetal movements feel like, they may start experiencing the fetal movements around 16 to 18 weeks of pregnancy itself. Then as the abdomen starts to become bigger, the patients start noticing that they're starting to develop stretch marks or blackish discoloration around the abdomen, thighs, breast. So these are the areas where the stretch marks start to develop. So the care must be taken regarding the regarding the stretch marks and prevention and lightening of these stretch marks. Then the patient may start telling that they're noticing little bit of swelling in the lower limbs and facial puffiness is there. So as the abdomen starts to become bigger, the blood flow or the circulation that goes to your lower limbs or legs starts to decrease. Plus, if you stand for a longer time, if you are a working mother who sits down in front of her laptop for a long period of time, she can sometimes develop lower limb edema. So these are the symptoms that you notice only the starting and continuation of second trimester of pregnancy. And once all this happens, the mother can also start complaining that she has more frequency of urination. She needs to go to the restroom or washroom repeatedly because the abdomen and the uterus is growing. As the uterus grows, it presses on the urinary bladder, which can cause such increased frequency of urination and symptoms of urinary discomfort. So these will be the main the differences that the mother starts noticing in the second trimester of pregnancy. And sometimes the pressure symptoms, because of the growing uterus, she can most commonly complain of low backache or a strain or a pull in her back area, which can again be relieved with a warm bath or a warm compress, which we will advise as and when she comes for her checkups. Okay, so these would be mainly the signs that she notices as she grows into the second trimester of pregnancy. During the second trimester of pregnancy, we usually start them on some multivitamin, iron, and calcium supplements, which I will be talking to you about. When we start off with these supplements, some mothers can experience some amount of gastritis as they are getting adjusted to these medicines. So they can complain of belching or indigestion or some amount of gastritis, because of which they might, delay in taking the tablets, or they may feel that the tablet is not getting adjusted to me. But we will still always say that these are the symptoms which will gradually reduce as the pregnancy advances. Okay. So there are something else, some other symptoms that a mother can notice, known as Braxton Hicks contractions. Braxton Hicks contractions is a painless contraction or a painless hardening of the uterus, or your whole abdomen starts to become a little harder. So this is also noticed in the second trimester of pregnancy. Usually these are painless and they don't cause any problem. Your baby movements will continue to be good, but only if you start noticing any pain during these contractions or anything, you immediately need to see your doctor. So this is also one of the symptoms that you may notice in
Sorry
your.
to interrupt,
Yes.
doctor. Sorry to interrupt. We have a question. It is it safe to travel?
Yes, usually it is safe to travel during the second trimester of pregnancy. Usually, the first 3 months of pregnancy, where the pregnancy is still establishing itself, there is a high risk of spotting or bleeding PV in some patients. So, we advise them to avoid traveling in the first 3 months. And once the third month scan, which is known as the NT scan, is done, and we know that everything is fine, the baby is growing well, and the reports are normal, if the patient does not have any other complications in pregnancy, we usually tell her that a travel in her own vehicle or a train travel is definitely safe until the beginning or the mid of third trimester. That is up to 30-32 weeks, she can still travel. If air travel is recommended, it depends on the airline policy, but otherwise it is quite safe to travel in the second trimester and early third trimester, not towards your delivery due date. So that is quite okay. Okay, so continuing with our second trimester signs and symptoms, I think we were talking about the Braxton Hicks contractions. So they are painless contractions which you may feel, my uterus is suddenly beginning to harden. Is it okay? Yes, it is okay if there is no pain. If it is coming once in a while, that is not an issue. And when you go to your doctor for your general checkup, you can raise this concern about the contractions and they will examine you accordingly. We will examine you. And like I said, urinary symptoms will be there. If by chance you notice that there's any burning, there is any difficulty in passing urine, or if there is any pain or fever during micturition, you have to consult your doctor immediately regarding the same. So these are the basic signs and symptoms that we notice as the second trimester starts and begins to continue into your third trimester. Okay, so what do we do in the second trimester of pregnancy? Second trimester of pregnancy, like the first trimester, we always advise you to come for a monthly checkup. So every month you need to come down to visit us, a gynecologist, who will see your general vital status, your blood pressure, and your weight gain. and then we will advise you what needs to be done accordingly. Coming to the medicines that we advise you in the second trimester, usually in the first trimester or the first 3 months of pregnancy, we would have started you on folic acid supplements. When there is vomiting sensation, we would have put you on antiemetics or vomiting tablets. And in patients who are at any high risk or required patients, we will advise you progesterone supplements. So all this will gradually be tapered and stopped by the 12 to 13 weeks of pregnancy. And as your vomiting symptoms subside and become better, we will put you on iron and calcium supplements. So iron and calcium supplements are started, which is to be taken once a day. And then we put you on protein supplements, which is to be mixed with milk and usually taken. Okay. And some patients ask us, is it compulsory that we take these supplements? See, supplements are usually given as an add-on so that you feel better, you gain good weight, and the baby gets adequate nutrition for the growth of the baby. There are some patients who say that I don't want to depend on supplements and I want to improve my diet and take it as such. So you can do that also, where you take a good iron and calcium rich supplement, and protein supplements which can be got from sprouts and other vegetables and cereals. So we will advise that also accordingly. But ideally, iron, calcium, and protein supplements is usually advised from the second trimester, which goes on throughout the whole of pregnancy until you deliver and beyond, as we advise you. So that is the basic things that we start in the second trimester of pregnancy. Then vaccination will be advised to you when you come down. Usually by the end of the first trimester, that is between 12 to 13 weeks, an important scan is done, which is known as the NT scan, and a double marker blood test is done. So once this is done and it comes out normal, we advise you to take a first dose of tetanus toxoid injection. So after that is done, usually by the CDC committee, we advise you to take two types of vaccine. That is a tetanus toxoid between 12 to 13 weeks of pregnancy, and a flu shot, that is a flu vaccine which is to be taken between 20 to 22 weeks of pregnancy, and a DT and diphtheria and tetanus toxoid vaccine which is to be taken by 28-30 weeks of pregnancy. So this will be your vaccination schedule in pregnancy, which will also start from second trimester of pregnancy. Okay, I have another question that is coming up over here. Is it safe to have sex during pregnancy? Yes, it is quite safe to have sex during pregnancy. Like I spoke about traveling, even for a husband and wife to have a safe sexual practice, it is usually advised to avoid sexual practice during the first 3 months of pregnancy, where there are high chances of intermittent spotting or bleeding that can happen, which can precipitate an abortion. So we usually advise any high risk patient or any couple to avoid sexual activity in the first 3 months of pregnancy. Once we do the third month scan, we see that everything is good. There is no high risk for having sexual activity. Some of the high risk factors where we advise the patient to avoid sexual activity is a low lying placenta. When we do the third month scan, we see where the position of the placenta is. If the placenta is not low lying, there is nothing to fear about sexual activity. If the patient does not have any history of cervical incompetence or a weak cervix, where she has not had a previous mid trimester abortion, in such cases also we tell the patient to avoid sexual activity. Or if there is any other medical condition associated with pregnancies which could put the patient or the child at risk, only in such patients we tell them to avoid sexual activity. Or else it is quite safe during the second and third trimester to have sexual activity during pregnancy. Okay. So continuing with the care that we start off in the second trimester of pregnancy, we spoke about the medicines that we advise, the vaccinations that is given during the second trimester of pregnancy. The other commonest things that the patients come up with is what are the physical activities or what are the exercises that we start during the second trimester. So in the first trimester, any kind of physical or strenuous activity, lifting weights, and any activity that puts pressure on the abdomen is usually avoided until the pregnancy is well established by 12 to 13 weeks. Once that is completed, we usually tell the patients that it is quite safe that they can go ahead and start practicing minimal exercises. So they have to start with minimal exercising of 10 to 15 minutes per day. And as their body permits, as they are feeling good about it, they can continue to increase it to 20 to 30 minutes a day. And this physical activity or exercising should usually include brisk walking after a meal. They can do prenatal yoga, which will help them to relieve the stress, the back stress, which usually starts to develop during pregnancy. And also it aids in a good delivery process during delivery. So prenatal yoga is a very good form of exercising which they can start from second trimester of pregnancy. They can start brisk walking. If a patient is well accustomed to swimming prenatally before pregnancy, if she knew swimming, if she used to swim regularly, then we can advise her to do her swimming classes, to continue with that. That is also quite safe, who are already well accustomed to it. And they can continue with their regular household activities, like doing their household activities, washing, cleaning, cooking. All those activities can be resumed and continued without any problems. Only things we avoid is any abdominal stress and any abdominal pressure bearing activities, that should be avoided. Otherwise, physical activities like walking, prenatal yoga classes, all that can be started during the second trimester of pregnancy. Then coming to the posture of how we need to sleep during the second trimester. That is also a common question or a common advice that is given to the patients during the antenatal checkups when they come. So as the uterus starts to grow, we find it very difficult to sleep on our back. So it is not very easy or very comfortable to sleep on our back, and we don't advise the patients to do so, because the blood flow to the baby should be good, the nourishment the baby receives should be adequate. So we always advise the patients, kindly sleep on your left lateral position, because according to studies, a left lateral position always enables good nourishment to the baby, a very good blood supply to the baby. So it prevents growth restriction, it enables the baby to grow well, and a good weight is gained for the baby. But if by chance you have back pain, if you're not able to sleep continuously on your back, you can always turn to the other side of your belly and turn to your right side for some time. Ideally, the left lateral position, turning on to your right side but never on your back. So this would be the sleeping posture which needs to be changed from the second trimester of pregnancy. There's another question coming up in between. Can we smoke or drink during pregnancy? That is a definite no in pregnancy. Ideally, preconceptionally itself, if you are a smoker or a drinker and you're planning to have a pregnancy, ideally you should stop both smoking and drinking before planning pregnancy, and only then plan for a conception. There is something known as sudden infant death syndrome, alcohol induced baby syndrome, which happens in chronic smokers and alcohol consuming mothers. So the baby can have a lot of cognitive or brain development deformities and other deformities like cleft lip and cleft palate. Some hearing deformities can develop. So all this was noticed in babies born to mothers who were having a habit of smoking and drinking during or before pregnancy. So ideally, if these habits should be ideally stopped before pregnancy, then plan for your pregnancy, and a definite no during the pregnancy. Even passive smoking, even being next to smokers, or next to a person who is smoking, is a no. Even if your partner is a chronic smoker or he smokes, it is always advised to tell him not to smoke with you being around. Passive smoking is also not advised during pregnancy. Okay, so moving on, what else do we advise during the second trimester of pregnancy? So we have spoken about the medicines, the exercise to be started, and the vaccination that is given during the second trimester of pregnancy. Next, let's go on to the lab test or the blood test that we advise. Usually in the beginning of pregnancy itself, we would have done a couple of tests to know that all your profiles are normal and everything is going good. In the fifth month, around 20 to 22 weeks of pregnancy, we again repeat basic investigations of pregnancy. It could be your hemogram, and also when patients are prone for other gestational abnormalities like gestational diabetes and hypertension, this is also screened during the second trimester of pregnancy. So oral glucose challenge test or an OGCT is ideally advised between 20 to 22 weeks of pregnancy, because of which we can do a screening of the gestational diabetes to know if the mother is prone for diabetes during pregnancy. And during the second trimester, beginning of second trimester, between 12 to 13 weeks, we do a very important scan which is known as an NT scan, in which we also see the blood flow or the Doppler flow to the baby. In this, we know if the mother has a high risk of developing pregnancy induced hypertension or preeclampsia in pregnancy. So to such mothers, we advise a low dose of ecosprin or an aspirin tablet to be taken started during pregnancy. So these are all screening tests that we need to do during pregnancy. This is during the 20 to 22 weeks period. So screening test for diabetes and screening test for hypertension, and your regular screening of your BP readings will be going on whenever you come for your antenatal checkups. Okay, I have another question coming up. Can we do salon services like waxing and hair coloring during pregnancy? Yes, definitely. Salon services is not a problem during pregnancy. You can continue to do waxing and coloring. Some hair colors are usually toxic, but hair colors do not get mixed to such an extent that they penetrate your scalp and then reach your bloodstream and reach your fetus. So very unlikely chances that they will have any effect on the baby. Procedures like waxing and everything, or threading and things like that, they can induce pain in some patients if your skin is very sensitive. So make sure you can do a patch test or something like that to see if you can bear the pain or if the pain is too much. If you feel it can be postponed, then all such things can be postponed to after delivery. If you are comfortable with it, if it is not causing any pain or rashes or any such problems to you, you can go ahead and do the salon services. So no such procedures is contraindicated in pregnancy. Okay, so I hope that is clear. So continuing with the tests that we do in pregnancy, so we told about the screening test that is done for gestational diabetes and hypertension. Another important test that, like I told you, was the NT scan, which we did during the 12 to 13 weeks of pregnancy. So if by chance for some reason you have missed the NT scan at around 12 to 13 weeks of pregnancy, or you have done only the NT scan and you have not done a very important genetic test which is known as the double marker, you get another option in your second trimester of pregnancy at around 16 weeks. So at 16 weeks, we can advise you to do another test which is known as a quadruple test, which is also a genetic test, which will tell us if the baby has any risk of developing genetic abnormalities like Down syndrome, Klinefelter syndrome, Patau syndrome. All these are the important genetic abnormalities that are seen in the Indian population. So if the baby is prone to any such abnormalities, we can detect that by doing this particular quadruple test that is advised at around 16 weeks. If you have already done a double marker and a NT scan at 12 to 13 weeks, then there is no need to repeat a quadruple test. If by chance you have missed that, only then we advise you to go through a quadruple test. Okay, so these will be the basic blood tests that we usually advise during the second trimester of pregnancy. Then moving on to the scans, like the NT scan, which is very important. Another very important scan is done in the second trimester of pregnancy, which is known as TIFA scan. That is a anomaly scan or a TIFA scan. They both are the same. It is a targeted imaging for fetal anomalies. So it has a particular sensitivity to detect if there are any abnormalities in the growth of the baby or the organogenesis of the baby. So this is a very important scan which is done anytime between 18 weeks to 22 weeks. Usually the radiologist or a fetal medicine specialist will see the scan and note the organ development of all the organs of the baby is good and the organ development is complete, because ideally the organ development is complete between 20 to 22 weeks. All the organs, right from the brain to your outer organs, your limbs, everything is developed by around 20 to 22 weeks. So the fetal medicine specialist will see this and advise us if there is any abnormality, if there is any follow-up to be done, or the baby is safe without any anomalies. So this is one important scan that needs to be done at around 18 to 22 weeks. In high risk mothers, or in mothers who have gestational diabetes in pregnancy, or who are overtly diabetic, or who have a family history or a previous pregnancy history of having gestational diabetes, we advise them to go through a fetal echo. Fetal echo is a heart scan of the baby. So this is done for any baby of a high risk mother with gestational diabetes. So this is done again at around 22 to 24 weeks. This is again an important scan which is done at second trimester. And a fetal echo is not advised to all the mothers. It is only to the high risk mothers who have gestational diabetes or have had a past history of gestational diabetes. Then we continue on to what all is advised in the second trimester of pregnancy. Rest, like I told you, second trimester of pregnancy, Okay, what is a 3D scan and when should I do it? A very good question. As I was talking about the scans, a 3D scan, like I told you, when we do a TIFA scan or a targeted scan to know the anomalies, sometimes the radiologist might pick up an anomaly which they want to clarify or which they want to more clearly delineate and confirm. That time, the radiologist can ask for a 3D scan where the anomalies are more prominently seen, are more clearly seen, so they can give the images. It is easier to explain to the patient. So 3D is nothing but a three-dimensional scan. So it is not done to all the patients because it is not necessary, it's time consuming and money consuming. So it is usually advised only when we need to see the anomalies more clearly, to explain to the patient and to clarify our confirmation of the diagnosis, also to know that there is such an anomaly. Also, some parents may ask that we want to see our baby much before it is born. So in such parents, we can offer them a 3D scan, which is ideally between 26 to 30 weeks of pregnancy. That time, the water content around the baby is very good. The baby is of the ideal size. So we can get a 3D image of the baby's face. So that is like the first look of how your baby is going to be seen after it is born. So you can ask for a 3D scan to have a look at your baby also, if you're very anxious to know how he or she is going to look like much before they're born. So that is another reason why a 3D scan can be done. Otherwise, a 3D scan is not routinely advised for all the patients. Okay. So moving on, what else is required during second trimester of pregnancy, or what else we advise during the second trimester is rest. Rest is advised for which kind of patients? Like I told you, the first trimester is over, you start feeling much better, much lighter, but still we tell some patients to continue taking rest in second trimester of pregnancy. Who are these patients? They are the ones who are at higher risk. Maybe previously they have had a mid trimester abortion history, they have a low lying placenta in one of their scans, which could be done at the third month or fifth month. So they have a placenta which is on the lower limit, so they're at a higher risk of having bleeding or pain during pregnancy. So we tell them to have adequate bed rest. If they're by chance they have undergone any procedures like cervical encerclage or a cervical stitch, when patients have had a previous history of mid trimester abortion, usually they undergo a procedure known as a cervical stitch. That time we advise them to take adequate rest. They can't do the regular activities or exercises like we advise to all the patients. So the high risk patients who have any history of cervical encerclage, low lying placenta, any pregnancy related complications with pregnancy like gestational hypertension or diabetes, where rest is advised, only to such patients we advise to take additional rest. Then some patients ask us, what about our dental hygiene during second trimester of pregnancy? Like we all know, pregnancy will have its own cravings and its own sugary needs. So some patients are more prone to develop caries or dental problems. And because of the estrogen and progesterone effect during pregnancy, we are prone to something known as pregnancy-induced gingivitis. So our gums can be swollen, tender, and sometimes there can be some amount of bleeding. So generally, a second trimester dental checkup is always advised to all the patients, where they can go to a dentist and have a general dental examination done regarding the care of the teeth. And if there is any procedure that can be postponed to second after the delivery, like a root canal or nothing like that, it is ideally postponed after delivery. But if there is an emergency where they have to undergo a procedure, they can undergo any procedure during the second trimester of pregnancy after thoroughly consulting both the gynecologist and the concerned dentist. So those are also symptoms that we need to look into during the second trimester of pregnancy. Another thing we advise during the second trimester of pregnancy, between 28 to 30 or 32 weeks of pregnancy, is the need for steroids. So steroids is an injection which is given in high risk mothers whom we suspect that they may go in for preterm labor. So who are these patients who may go in for preterm labor? Maybe she's had a previous history of preterm labor, of delivering a baby before 37 completed weeks. Maybe she has a pregnancy complications like a huge fibroid along with pregnancy. Maybe she's carrying twins or triplets, that is multiple pregnancies. She has other medical complications like diabetes or hypertension in pregnancy. So such patients, we are doubtful that maybe she might go into preterm labor. And what if she goes into preterm labor? So we need to prepare the baby to come out and go through a smooth journey in the NICU also. So ideally in such patients, we advise a steroid injection of betamethasone that is given around 30 to 32 weeks of pregnancy. It is a dosage of two injections which is given at a gap of 24 hours. So two doses given between 24 hours. So that is ideally advised between 28 to 30 weeks. In high risk patients, up to 32 weeks we can give that. Okay, I'm going to answer another question. I'm experiencing foul smelling white discharge during my pregnancy. Why does it happen? See, pregnancy as such is an immunocompromised. It's not immunocompromised as a disease state, but there is a lot of immune system mechanism that is happening during our pregnancy. Our body is going through a lot of changes. So we are generally more susceptible or more open and prone to infections. So any pregnant woman is always prone to more of vaginal and urinary infections. Plus, if she has a complication in pregnancy like gestational diabetes, or if she is overtly diabetic, or if her sugars are fluctuating in pregnancy, then they are more prone to fungal infections during pregnancy, which could cause a foul smelling white discharge. So foul smelling white discharge is definitely not safe. So as soon as you notice any such things, immediately consult your gynecologist, who will do an internal examination and see what kind of infection it is, and she will treat you accordingly. If the symptoms keep repeating repeatedly, then we may have to treat you with a course of antibiotics. We may have to tell you what kind of hygiene you need to follow and what are the tests you need to go through. But maintaining hygiene and following adequate prescription by your gynecologist is sufficient to reduce the white discharge during pregnancy. And take more of immune building drugs, immune building vegetables, fruits, and more of yogurt and yogurt based foods. All this will improve your good bacteria in your vaginal area. So this could also help in reducing the white discharge in pregnancy. Okay, so moving on. Some patients ask us, are there any procedures that we need to undergo, or are there any procedures that are safe during second trimester of pregnancy? There are no procedures that you need to undergo other than your routine blood tests and these important scans that I told. In high risk patients, there are sometimes some investigations and some procedures that they may need to undergo. Like we already discussed, there is a procedure which is known as cervical stitch or a cervical encerclage. So if a patient has had a previous history of mid-trimester abortion between 18 to 20 weeks, that time we feel the cervix is incompetent or it is short. So in such short cervix patients, we always tell them to go through a cervical stitch or a cervical encerclage, which is usually done after the NT scan. That is around 13 to 14 weeks. After that, they have to go through a procedure of of cervical encerclage. So that is one procedure. Any dental procedures they can undergo in second trimester. Then there can be, earlier there used to be invasive procedures like amniocentesis and cordocentesis which used to be done. That is also again for detecting genetic abnormalities in the children. But now such procedures are better avoided because we have better diagnostic tests like NIPT, double and quadruple markers, which will tell us better about the baby deformities or genetic abnormalities. So such invasive procedures we usually avoid and try to detect it with non-invasive techniques itself. So these are the main things that are usually advised during the second trimester, and what all the procedure of how to go about the signs and symptoms, what are the tests to be advised, what are the medicines to be taken, what is the care to be taken, and everything. So why can't I know the gender of my baby in India? So, gender revealing is illegal according to our rules in India. There is a PCPNDT Act that has been passed by the government of India, which stops any radiologist or any sonologist from determining the gender of the baby. This is only for equality, so that there is no child that is biased based on the gender. There is no child that should be terminated just because it is a girl or a boy, irrespective of whether it is a girl or whether it is a female or a male child. Every child has the right to survival. And unfortunately, in our country, in a little backward communities, there was a lot of feticide that was going on based on gender. So our country has passed the PCPNDT Act, according to which it is illegal, it is punishable, and the concerned people can be sent to jail if any sex revealing is done in our country. So that is definitely not encouraged, nor is it practiced. Moving on, what are the warning signs? We will wind up our session with the warning signs of second trimester. So when should I be worried? So pregnancy is going on smoothly. I've settled into the pregnancy. I'm happy. I'm comfortable. I'm more confident to become a mother now. But what should I look out for? What are the complications or the warning signs that I need to see in pregnancy? So a pregnancy, like we discussed already, profusely foul smelling discharge or recurrent white discharge during pregnancy is not safe. It needs to be addressed immediately, and you need to consult your doctor immediately and get it treated. Other than that, bleeding or spotting during pregnancy during the second trimester or any trimester of pregnancy is not safe. So you need to go where the doctor will examine you immediately. We will, if needed, we will do a scan to locate the placenta, whether there is any incidence of any placental separation or low lying placenta from where the bleeding is happening, and we will advise the treatment accordingly. So bleeding or spotting during pregnancy is not safe. Leaking or a water bag breakage is also definitely not safe during the second trimester of pregnancy. It should not happen. But in some patients, there may be some other complications like preeclampsia, or they may be having a twin gestation or a multiple gestation where the uterus is over distended. There may be a fibroid complicating the pregnancy where they are more prone to going for preterm deliveries. So they can end up with a premature rupture of membranes, or the bag around the baby suddenly ruptures and the water leaks. So you need to immediately come to the hospital, get admitted, where we examine you about what is the quantity or the type of leak that has happened, and how the status of the baby is, what are your weeks of pregnancy, what are the chances, what we need to do best for the mother and baby will be decided accordingly. So, bleeding and leaking during pregnancy is definitely not a safe or a healthy symptom. Then, swelling. Swelling, like I told you in the beginning, of the lower limbs is quite natural. If it reduces when you sleep and get up in the morning, it is quite okay. But a swelling that does not reduce due even after taking rest, or a swelling which is associated with the swelling of the face, if there is blurring of vision, severe recurrent headache, vomiting, these are all signs that your blood pressures may be fluctuating, or your blood pressures may be suddenly starting to increase, which is a symptom of preeclampsia. So this also needs to be addressed immediately, and you need to come and see the doctor immediately. And the fetal movements, ideally should be around 8 to 10 movements, which you notice better after a meal. So after every meal you can notice 3 to 4 movements. So over a day you can notice about 10 to 12 movements, which is good enough. If you feel my baby has not moved at all today, or the baby is moving very less compared to the previous days, you immediately need to come and see us. Accordingly, we need to examine and advise you. So these are the few things. Sudden cramping pain of your abdomen or your pelvic region, or sudden gush of fluid or bleed, which can be signs of preterm labor. So all these are the basic signs or warning signs which you may notice during the second trimester of pregnancy, which you need to immediately come and inform us and accordingly start the treatment. Okay, so these are about the main things that can happen during the second trimester of pregnancy, and the symptoms and signs that go on during the second trimester of pregnancy. I hope I have addressed most of the queries and most of the issues that are pertaining to the second trimester of pregnancy. Second trimester of pregnancy is the most enjoyable phase because the pregnancy is well into a good development. You have crossed the period where the risk of abortion and miscarriage is moved. After the 13 weeks, the pregnancy is better established. The pregnancy is more stronger to grow on its own. So you settle into the pregnancy, you start feeling happy about yourself, your appetite is good, your skin starts to glow, and all these changes is most enjoyed during the second trimester of pregnancy. So I wish I have cleared most of your doubts regarding the second trimester of pregnancy. I wish all the mothers a very safe and healthy pregnancy and childbirth, and we are always here to guide and take care of you. Have a good day. Bye.